Welcome to the Research Education Program seminar today. We have Dr. Amy Page who's joining us. Firstly, I'd just like to acknowledge that the country we are standing on at the moment belongs to the Whadjuk Noongar people, and I would like to acknowledge the wisdom of the Aboriginal elders, past, present and emerging, and pay respect to the Aboriginal communities of today. Our Research Skills Seminar Series has definitely kicked off for the year. We have over 20 topics across the entire research process, which we will continue to deliver through the rest of the year. Each lecture lasts for about an hour, and we do provide all of your handouts so you don't have to be furiously writing all the way through. Every lecture is recorded and uploaded to our open access website. Please ensure that you provide some feedback to us so that we can then tailor this program to meet your needs in the future. We do ask for recording purposes that you hold all of your questions till the end, and myself or Karen will come around with a microphone so that you can ask your question. So, without any further ado, Dr. Amy Page is a registered pharmacist and a qualified biostatistician. Her vision is to reduce medicines-related harm while balancing symptom control to align with individualised treatment goals for older people to improve their well-being. She undertakes knowledge creation and translation through implementation, practitioner development, communication and media, engagement with professional bodies and policy for sustained impact on pharmacy practices. She has received over $5 million in research funding and published over 130 articles, including more than 90 peer-reviewed papers. She has presented on medicine safety and the quality use of medications for older people nationally and internationally. Her research is frequently profiled in the professional and lay media. Please help me to welcome Dr. Amy Page.
Thank you, Julia, for that kind introduction. So today what we're going to be talking about in the next one of these research seminars is what is social media and how to use social media for your research. So what we're going to start off with talking about is just briefly discussing what is social media, and then talking about how we disseminate research. After that, we're going to briefly discuss social media and research, and then the platforms that can be used. Then followed by some examples and some suggestions on how to get started. And then we're going to talk about how to actually measure the impact with your research using altmetrics and some analytics, and then some caveats and challenges. So what is social media? I think we can all intuitively answer that question for ourselves. We all know what it is when we come to it, but there's actually a definition where it's around the websites and apps that allow us to create and share content with other people. So how do we disseminate research? It's one of those things where I don't know that we spend enough time thinking about how we're actually going to disseminate our research and how it's going to be shared. We spend so long talking about our research protocols, our ethics applications, who we're going to work with and engage while we're doing the research, how we're going to collect the data, how we're going to analyse the data, writing it up. But then we don't think about how we're going to disseminate it. So our papers are going to be just one of many, many articles that are published each year. In fact, there are 1.8 million new medical research papers that are published in peer-reviewed journals each year. So how do you actually make yours stand out from the crowd and make sure that all of your hard work is read? One of the ways we can do this traditionally is through conference presentations, which is obviously a fantastic way of being able to share it with colleagues who've got similar mindsets and similar interests who are prepared to go along to that session, particularly by sharing an abstract to the conference so that you can present a poster or even a presentation at the conference to share your findings. You can tell other people about it, whether this is your colleagues that you're working with, friends or other people that you know, or through email, and even sometimes through mass media. So if you do a media release that goes with your paper, it might, when you publish it, it might be picked up sometimes by the media as well. There's something though that you've got more control over as an individual, which is a lot easier for you to control, which is social media. So most people, once they've gone through the point of getting their paper through peer review and all of the endless rounds of revisions and making all the changes, you've done your proofs and you finally got it in press, most people feel a really great sense of accomplishment and that they've finished and move on to the next project and straight away forget about actually disseminating that any further. But that point of getting it into press, that point of seeing it online, that's just the first step in making sure that you actually get that impact from your research. More and more, particularly if you're relying on funding for your research, funders want to see that you've had impact from your research. And honestly, if you think about why we do research as clinicians, as healthcare professionals, other than if we're told we have to do it as part of a professional development program or a qualification or because our boss told us to, most of the time the reason we do research is because we want to make a difference. And we don't make a difference just by getting it in press. We make a difference by people being aware of that research and implementing it in their practice. And they can't do that unless they know that your research exists. And the only real way that you've got of controlling it for yourself is through social media. So once you get it out there, of course, with how much research there is, I'm sure it doesn't surprise you that people have actually researched how much of a difference your dissemination strategy, once it's published, has on its use. So there have been papers that have looked at how much access or how many downloads there are or citations based on if it's behind a paywall or if your research is open access. And unsurprisingly, open access papers generally tend to be viewed more, downloaded more, and cited more. Similarly, papers that you publish with a visual abstract, so a pretty picture as an infographic to describe what you've done, tend to get cited twice as much as those that don't have a visual abstract, and similarly with video abstracts. So basically we all like the quick summary and the visual guide to it. But the other thing is, after that's already done, what do you then do? If you disseminate the research on social media, well, it actually plateaus about 4 months after you've published it, so you've really got to hit it hard as soon as it's published. But that first 4 months, if you do it, you can actually increase it by up to 33%. Just by doing a blog post about it, just one blog post. But if you put it on Twitter, LinkedIn, Facebook pages, etc., you can really start to get it even further than that. This paper looked at the measure between altmetrics, and we'll talk more about altmetrics later. But altmetrics is one of these ways that we can measure how much attention it's had and a paper has had online. This article found that the increase in citations was about 13% if somebody did a blog post that went with their paper. It increased by 1.2% if you did a tweet, and sharing it on Mendeley, which is another social media platform to share your research, is increased with 1%. And obviously they did clarify that the impact factor of the journal did affect the citations as well, which is unsurprising, but that's something that once it's already been published, you can't control. So what platforms do you have to choose from? Obviously, there's so many different platforms, and there are some that are used more for research and less. But my advice would be to choose one or two and go with doing those platforms really well, rather than trying to make sure that you're communicating across every single platform. So some of the really common ones for research are LinkedIn, Twitter, though that has gone down in the last couple of months with the change of ownership. Facebook, but this is a caveat on this one, that generally only pages get picked up a lot, or groups. YouTube is often a really good one for sharing video abstracts or little snippets of research, and similarly TikTok is growing in that way too. ResearchGate is a really useful one for just making sure that you upload your most recent papers to that. And Mendeley, which is also a reference manager and an academic social networking platform. So some examples from Twitter. I did an experiment with a paper that I had published in 2022, looking at did any tweet have a different value than another tweet. If I tweeted using one approach, would it get picked up more than if I tweeted another approach? So this was the paper, and it was the first post, and it was done by the journal itself. So this didn't do too badly. It got 8 retweets and it got 4 likes. So it just basically said that there was a new article, the name of the article, and where to read the article with the link. Now, it's really important that you always put the link so that A, people can click onto it, and B, the analytics can pick up on it so you can track it later. And a couple of hashtags. I wanted to try with this one if I would get a different response if I did a GIF. I always struggle, is that GIF or GIF? Anyway, I did a GIF and just went through some of the key findings, and I asked a question about it and tagged a few other people. I was a bit disappointed that I thought that doing a fancy GIF would actually get me a lot more attention, and it actually got less attention than the first one, which was just saying that the article had been published. And then I tried doing it's been cut off at the bottom, I tried doing a video of it that was a 1-minute summary of it. And even though you can't see it there because it's been cut off, it actually didn't get much attention at all, which was a surprise to me because I thought that a video might have gotten more attention. This infographic actually did the best compared to those earlier ones, where people just liked the image that quickly summarised it. It had 29 retweets, 53 likes, 4 people bookmarked it and 3 people commented on it. So a really quick, snappy picture actually did better than a GIF or a video. Again, another infographic that did really well with a lot of attention on it on the same paper. And again, another infographic that did really well on the same one. So just as a single paper, as an experiment, I definitely found that quick, snappy image actually did better than anything that required that little bit more time to look at it with a GIF, where you have to slow down and really actually wait for it to cycle through, or a video that takes time to look. Now, this might be different across different platforms. So it might be that on Twitter that's the response, and perhaps on LinkedIn I would get a different response with the same sort of posts. So the message here is to make sure that you actually work out what's working for an individual audience, both for your particular audience, your topics, and the platform that you're choosing, because it can change. So how do I get started if you're not used to using social media to disseminate your research? The first step is to create those new profiles on those on whichever social media platforms you're choosing. So again, I'd just choose 1 or 2 and go with those ones to start. Make some initial connections, so reach out to people that you already know on Twitter or LinkedIn or ResearchGate or whatever the platform is that you're going to use, and really connect with those people. And then use those to grow your connections through conversations. It's useful to use a consistent profile photo across all platforms because people will start to recognise you by your profile photo as well. And choose a photo that reflects who you are as a researcher. So people tend to not engage with the Twitter account that has the egg symbol still as their photo. But also choose one that actually portrays how you want people to see you or what you want people to think about when they connect with yours. Take time to create an effective profile. So people aren't going to read too much. Then they just want to see a quick snapshot. But they also want to see that you're you. They can quite easily engage with a professional association or some other organisation if they just want to hear it, the official line. But people are engaging with you because they want to hear what you as an individual think, and they want your personality to shine through. But also remember while you're thinking about how you want to be portrayed, do remember your audience and what they're particularly interested in. So it might be that if you're trying to create an audience around your particular research area, that same research might not be interested in the online game that you play. You might need 2 different profiles for those different activities. Or sometimes some people do manage to blend a couple of different ideas through, but you generally want a consistent message for your audience. So this is from my Twitter account and my LinkedIn account. So you can see that I've got the same profile photo across both, but they're both targeted just slightly differently with the banner image for the platform. So once you've started your profile and you've chosen your platforms, just try and link in with those communities. So sometimes you'll notice that there are people in your community that you want to reach out to. So if somebody's sharing something that's of interest to you or relevant to your field, just engage with them. Retweet what they've said or comment on their post. Ask questions about other people's posts that are similar to yours. Posting regularly and with variety really helps. So this is where you make sure that you're consistently posting, because the algorithms on these platforms are going to actually favour people who are posting consistently and regularly, because that's what works for the social media platforms as well. So if you only go in and post once every 3 months, it's unlikely that your post will actually be visible to the people who you're connecting with. So it might only be shown to 4 different people, whereas if you're posting regularly and consistently, your post might actually be shown to hundreds or thousands of people. If there's a current event that's really relevant, make sure that to your research, make sure that you're commenting on it. So it might be that there's something in the media about something relevant to your research. So it might be useful to share the media article and comment on it as an expert to provide further clarification or to start a conversation yourself. Do make sure that you keep your profile up to date too, because sometimes people can have their profile become out of date and it doesn't show what they're currently doing now. So sometimes it's actually really useful to have a dissemination strategy for so once you've got your profile together, you then need to think about how you're going to use your profile to share the research that you do. So there's a rule of thumb that basically you're trying to create 2 posts to every one that's general, to every one where you're sharing something about your research, so that people are seeing that you're engaging in a conversation and not just there to tell them about your research. So when you are going in and talking about your research, think strategically about how you're going to start sharing that research. You might choose to do a daily tweet from your social media account about your particular paper and share the evidence from that paper, or you might share particular lines from the paper or a particular finding. In 2,000 words, 3,000 words that you've got in a peer-reviewed publication, there might be 1 or 2 key statistics too that you want to get that message out there with. So by people seeing it consistently, that will help them remember that key stat or that key message that you want people to take home. This was the structured strategy that one of my PhD students came up with for sharing her research. So she had just published her third paper from her PhD, and she shared this with all of the co-authors about what the structured strategy was going to be for everybody to share the research. So by leveraging the fact that she had a number of co-authors and that they would all be able to follow a set plan, they actually did really well in managing to get this article seen by a lot of people and used a lot. She also, as the first author, went and actually wrote some sample tweets that people could use, so that there was just cut and paste for the co-authors, which made it really easy for everybody else to share that consistent messaging and to get it out there. I think that was probably one of the most strategic approaches I've seen, and it was probably the only time I've seen every co-author actually follow the same social media dissemination strategy in getting that document from her when it was published. This is the second part of that strategy. So when you're sharing your research online, one of the things that we need to do for our subsequent research projects is often that we need to show that we had impact from our previous research. We're always being asked when we've done research what the impact or the outcome of that research was. So if we don't know how to measure the impact of our social media reach of our paper, how do we demonstrate that impact? And on a micro level, if you're trying to structure and modify your social media posts to get the best impact, like I showed you with those series of tweets at the start, which I could see which ones had done better than others, how do you modify them if you're not actually analysing the response to those tweets or those posts in the first place? So LinkedIn has its own analytics like every other platform, so it'll actually show you who's looking at it, where they're coming from and what cities they're coming from, as well as how many views and how many reshares. So this is really useful to go in and have a look at each of your posts and see where those people are coming from. It also helps you plan for future posts if you know where your audience is from and if you've got any other insights into what they might be interested in too. If your research is supposed to be all about medical education, but everybody who's coming in and having a look at your post is actually from antimicrobial stewardship, you might want to restructure how you're putting those posts together to make sure that your audience is more structured. Or you might have a look at what it is about your post that has attracted that different audience as well. Twitter does a similar thing. It doesn't tell you who has looked at your posts, but it tells you how many impressions it has had and how many people have actually clicked through to look at any photo, any images, any that you've posted on there. So media covers any images or videos that you've posted. And it also tells you as well the total engagements, which is the likes, the profile clicks, the link clicks, the retweets, and the engagements with the media. Sometimes it does, some people, which isn't relevant, I'm sure, to most of us, but it does give you the option to promote or pay for a tweet. So the impressions that you're given in your analytics only shows how many times it's been organically viewed. The media views is just the views, the autoplay and click of your media. Altmetrics and Plumex are two fantastic ways of being able to track your global impact and reach of your research, though. As long as you've got that link in your post or your tweet to the article, whether that's the DOI or the link from the website itself, Altmetrics are going to track it. And what it'll do is that it will track any any links, any shares on something called Faculty of 1,000 citations on Wikipedia and in any public policy documents, discussions on any blogs, mainstream media coverages that are online, and bookmarks in reference managers like Mendeley. And it'll also include mentions on social media such as Twitter, Facebook pages, but not groups or profiles. But it doesn't count some of these towards the score. So what it does is it gives you a score where you can actually, it'll tell you what that score will then calculate into a percentage rank to tell you that your paper has performed better than however many other proportion and number of other papers published at a similar time or ever. So it might tell you that your paper has performed in the top 25% of all research papers ever published for online attention, or it might tell you that your paper is number 10 for attention compared to other papers published at the same time in the same journal. So it's a really good way of just being able to measure how your paper is tracking compared to others. So one of the main ones that's picked up by Altmetrics is the Twitter shares, partly because that's one of the largest ones that we can affect as researchers, and by sharing it, it tends to have the largest volume. So Altmetrics is often largely driven by media shares and also by Twitter. So this paper had a look at the number of whether the tweets and the Altmetrics scores early on, say within the first couple of months after a paper has been published, if it can predict how many citations the paper has later. And it actually found really good sensitivity and specificity, that the top cited articles can usually be predicted by if they're the top tweeted articles early on. Other research since then has found that articles that are being tweeted or shared have good Altmetrics scores generally tend to perform about twice as well on citations than ones that don't. So there's actually a really good benefit for those traditional metrics of citations as well from being able to focus on that social media dissemination strategy. This is the slide that goes with that. So this is the paper I showed you earlier with the Twitter, the different tweets that I tried. So you can see here, this is what the Altmetrics profile shows you that it will look like. So it will give you a summary. It'll show you the title of the paper, where it's published, the DOI, and the authors and PubMed ID. And then it'll tell you what the Altmetrics score is, and it'll give you a donut with that in it. The donut colours actually mean something. So the yellow shows that it's been on at least one blog. The green shows it's been identified in at least one description of a YouTube video. The light blue is a Redditor. The grey is Wikipedia. And the dark blue is Facebook, whereas that light blue is Twitter. So the light blue is much stronger in that banding because most of the attention comes from Twitter. So any empty ones that haven't been filled in by other colours default to whichever one's the most predominant media source there. So you'll see with this one that it shows you those same ones along the top, so you can actually click into them to see where those links are if you want to go and check them out in more detail to see which blog is looking at your research or which YouTube channel. But it'll tell you here about your other metrics in context. So this one shows me that out of it's 8,504th, which doesn't sound very impressive, out of 429,000 different articles of a similar age, or from outputs from that journal of a similar age, or outputs from that journal of any age. It's number 12 out of 321 articles that have been published and tracked by altmetrics from that journal. It also puts it in context here that it's tracked 25 million research outputs across all sources so far, and that compared to this one has done particularly well and is in the 98th percentile. It's in the top 5% of all research outputs ever tracked by altmetrics. So that phrasing is really nice to be able to use in other bits when you're having to justify to somebody that your research did get attention and people are paying attention to your research. So let's talk about some caveats and challenges to sharing your work on social media. Which platform do you pick? Again, there's no right or wrong platform. For somebody who really likes making videos and really enjoys it, then YouTube might be the most appropriate for you, or even TikTok. If you don't like making videos and that's not your thing, or you really like making shorts posts, then Twitter might be more appropriate for you. If you want to do longer posts with a lot more detail on them and much more formal in their style, then LinkedIn might be the most appropriate platform for you. So try the platforms out, see if it works for you, see if you like that style, and see if you can find your audience there. If you post something you didn't mean to, it's probably best to go and delete it as soon as possible, but there's not really a lot you can do about it on most platforms. The other thing about fitting social media into a regular schedule, though, which is something that people often try to do, is that it will be easier to do if you enjoy it. But as far as your research goes, it actually usually works better if you go and schedule these posts ahead of time. So like with that structured approach that I showed you earlier, what you can actually do is go into different platforms and just Google them to find them and work out which one works for you. But there are platforms where you can actually sync your social media platform to them and schedule posts ahead of time. So if you want to do posts about your paper over a 1 month period, you can actually set them all to go live in this, spend half an hour to an hour at the start actually setting them all up and set the date and time that you want that social media post to go out, and it will just do it automatically so that you don't have to actually remember to go on and do it each day. So in keeping with the idea that this is a social media presentation, I thought I would keep the formal part of the presentation to the first half, and then we'll open it up for discussions and questions.
Thank you, Amy. That was really, really good tips there for everyone. We have a question here in the audience.
Can I ask what about sharing to the public, not necessarily researchers? So the consumers?
So there's a couple of really good ways you can share to the public. One is that you think about doing a media release with your publication so that you get it out to the public through that lay media. If you've got a university profile, you can also go and do a pitch to some media places through the conversation and put in a pitch to the conversation about doing an article through the conversation, which gets picked up really nicely into that. Or you can reach out to any journalists or media outlets that you do know to try and get it out through those channels. The other one is through trying to tag or identify people who are the consumers that you're interested in sharing your research with on social media. So instead of trying to find your group through connecting with other researchers or health professionals, the group that you might try and engage with is actually consumers instead, particularly if there's a particular disease state that you're trying to target, that can be a lot easier to find that group on social media too.
I have a question here. Where did your altmetrics details page come from?
So when you go onto the journal page where your article is published, often in the corner of it there will be a thing that says information about your paper. It's on the right-hand side. Usually there's a little box and it'll give you details around the citations and the metrics of it in there. So if you click into there, you'll be able to get to that page.
Thank you.
Thank you. It's not so much a question, but a comment. For one of my previous projects, focused on primary care and consumers' perceptions of the quality of care in primary care, we had a social media recruitment strategy as well. So we recruited general public, members of the public as research participants through Facebook, and there was a good process for that and institutional support for the recruitment strategy. So they came up with, a good stratification approach for the audience and define the criteria that we would use for the advertising. And it was quite cost effective as well. So it didn't cost more than $100, and we had, up to 70 responses. We just needed 20. So just another point to note about social media, I suppose. It's a recruitment tool as well. Yeah, social media has been a good recruitment strategy for people. That's impressive that you managed to get 70 responses for $100. There's other research that's shown that for recruiting participants for interventional studies from social media, it can cost an average of between $18 to $21 in paid posts to recruit participants. It can be a useful strategy for identifying people. This was a while ago as well, so maybe it's more expensive.
I think it probably changes depending on what your research topic is too, and how much people want to engage with it, and also how much you're asking of participants. So if you're asking them only for their opinions in a survey, it might be a lot easier to recruit them than if you're asking them to participate in a randomised controlled trial where they receive an intervention.
Amy, just wondering if engagement changes if you use your title, say doctor or professor, or whether or not that has any impact on your altmetrics.
I haven't tried changing my title in my profile. I know some people do, particularly people who feel like they're from a particular demographic where they might not naturally command the sort of respect that they think that they would if they don't use their title. But I haven't seen any research on how that's affected it, and I haven't experimented with that myself.
Amy, do you have any tips on how to deal with negative comments on your posts?
It can be really, really challenging to deal with negative responses. I had one paper that was picked up in the mainstream media. It had over 200 different media publications, from front pages of major metro newspapers to the TV news and radio. On the first day it was published, and obviously that got a lot of comments on it because there was so much attention on it. Some of the comments were so left field or so heartbreaking in their responses to it, and I really just found that the most effective strategy was to not engage with with the comment sections and to have a look, because ultimately if somebody's going to be that negative about it, it's really challenging, and you're not going to change it, and often they haven't actually read your paper. Where they have read the paper, it's actually often interesting to engage with them. So we did have one paper where we were asked online after we'd shared it something about our recruitment strategy. And the person that who asked and who we responded to obviously didn't think that our response was completely satisfactory because they wrote a letter to the editor about the limitation of our recruitment strategy, which we then got the opportunity to respond to and say, yes, we agree with the comments and the feedback, but every research has its limitations. And while we acknowledge this is a limitation, we acknowledge that in the paper. We had a choice of either doing the research with that limitation or not doing the research at all. So I think it's about just maintaining that non-emotional response, and also waiting that, you know, if it is actually truly a very negative response, maybe actually just putting down the phone or the computer and not responding for 24 hours until you've had a chance to overcome that initial emotional response, so that you can respond calmly. Generally speaking, that first response you type should probably not be posted.
I think that's some very sound advice. Thank you so much. That was an incredible lecture. Some great tips for us to carry on with our own research and dissemination of our own results. Okay.
Thank you, Julia.
Okay. Please make sure that you all complete your feedback so that we can tailor the next year's course to your needs. And please keep an eye out for our upcoming seminars. So on the 22nd of March, we have an Introduction to Good Clinical Practice by Alexandra Robertson, and also on the 19th of April, a talk by Tracy Chapman on research governance. Thank you all.